All right, let's call this meeting to order. Okay, everybody. So it is Friday, February 18th. I'd like to call this special school committee meeting to order. Mrs. Kennedy, can you call the roll, please? You just got to unmute. Oh. You're still muted, Mrs. Kennedy.
Okay, sorry.
That's okay.
Mayor Reardon?
Here.
Ms. Hall?
Here.
Ms. Walker?
Present.
Mr. Callahan?
He is
Mr.
absent.
He's absent. Okay. Ms. Spalding?
Here.
And Mr. Menon?
Here.
And Mr. Cole?
Here.
All, one absent.
Okay, can we stand for the Pledge of Allegiance? I guess you can see my flag in the back. I pledge allegiance to the flag
of
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everybody. So I guess, again, we called this meeting just to give some context. DESE announced, I think it was a couple of weeks ago now, that the school mask mandate, statewide mandate, would be lifted on February 28th. The Board of Health met last night here in Newburyport. I don't know if any of you were able to attend the meeting, but they voted unanimously 3-0 to lift the indoor mask mandate here in Newburyport, effective immediately. So we're really meeting this morning to hopefully, revise our mask policy. So when, kids are about to leave for vacation this afternoon, when they come back to school on February 28th, that we move to a more mask optional policy. And I think this came about, the special meeting, because our chair of the policy subcommittee around policy, Sheila Spalding, thought that we should, after reviewing the policy that we adopted last year, thought it was necessary for us to come together and take another vote. And so I think that's a great idea. So thank you, Sheila, for recommending that. I guess we could open it up to some discussion. I don't know if Sean wants to give some context on his end. I will just mention one more thing. What kind of prompted the vote as well was that the Massachusetts Interscholastic Athletic Association, which kind of operates on their own, not as part of DESE, also passed and also lifted the mask mandate for athletics going forward too. So it just made sense to kind of get all on the same page and get coordinated and get this messaging out before people leave for vacation, so they know when they come back on the 28th that it will be a mask optional policy. And I'll open up for some discussion and then we can take a vote. I don't think this needs to take incredibly long, but I want to make sure everyone has a chance to speak.
Yeah, Mayor, if I may.
Absolutely.
Sure.
Mr.
Thank you very much. So, and I I touched base with some parents this week, and as Mayor Reardon said, there was with the DESE along with the governor ending the mask mandate on the 28th, along with the MIAA. The other piece that had to fall into place before this meeting was the Board of Health vote, which happened last night. So this is why we're in a special meeting, because we felt it was really important for the school committee to come together, and as Mayor Reardon said, whatever the decision is going to be moving forward, to give families and students enough time, enough leeway time to be informed, but also make the adjustments coming back. The other piece I just also want to once again is highlight is our medical advisory team. As you all know, for 20 months now, or maybe even a little bit longer, they've been meeting on Wednesdays. Most times it's every Wednesday. We did, I think, from the end of June to right after July, before the new Omicron variant came forward. We had a couple of weeks off from the medical advisory team meetings. But we've been meeting with our medical advisory throughout this pandemic. And I just want to credit our nursing staff and Lauren McDonald, along with the medical professionals that are actually living this virus on a daily basis. And they're at the ground level and can really provide us insight and information instead of reading, the Boston Globe or the Herald or different periodicals. So I just want to credit our medical advisory team, who's been instrumental. As we're moving forward, I think everything really came in place, and we've been talking at school committee where our goal is to have the vaccination rates go up. At the same time, the infection rates go down. And I know with the Delta, there was a specific criteria, but because the Omicron has been so unpredictable in general, that's what we were looking to see happen. So we've been talking about monitoring our data for the past 4 weeks. And just to give a comparison for the families, last month in Newburyport, there was over 500 new cases of COVID. This month, within the first couple of weeks, we're around 80 cases as a city. The school system last month, we had multiple cases throughout the school system with staff and students. We're starting to see even in the school system that the number of cases reported are drastically dropping. Matter of fact, this week, we've had no cases of students or staff. Looking at vaccination rates, I know last week we were kind of concerned with the Bresnahan. They were around 50% vaccinated. But Lauren McDonald, our nursing staff, working with our Board of Health, continues to monitor a lot of that data. And we're pleased to see that fully vaccinated students at the Bresnahan is 82%. At least one vaccination or one shot for those students is at 93%. The Mullen students at this time is at 67% fully vaccinated, and one shot is 75%. The NOC is at 73% fully vaccinated, and then 79% with one vaccination. And then the high school is at 82%, and then at 85% with at least one vaccination. And talking to Lauren McDonald in the Board of Health, the fully vaccinated rates we anticipate are going to go up because most of those students have already had the one shot of vaccine. And then the last piece, and we'll send out a communication after the school committee's decision, but we're really going to continue with a strongly encouraged masking, because we know mitigation strategies, and we are going to leave that up to the families if school committee decides to follow along with the state. But we would strongly encourage unvaccinated students and staff to continue to wear masks. As you all know, buses, that would not change. So we would be required by federal law on any type of transportation is still the mask mandate falls in place. A 5 to 10 day quarantine or isolation for students or staff that have been sick that do come back to school are required to continue to wear the masks. And then in the classrooms, cafeteria, this is where we would have encouraged masking. And then the health office would be required. And then outdoors, once again, is optional or encouraged masking. So it's not in all these different venues within the school, mask-free. We really just shift the responsibility back to the students and back to the families, and require, and allow them to make those decisions. But we still want to continue our mitigation strategies that have been so effective. In my last note, as we were talking, just want to credit our community, our school community. We were one of the first districts in the beginning of this pandemic to get our schools open, to have kids in person. And I think a lot of the work we've done behind the scenes, that's our ultimate goal, is to keep our schools open, so we don't have a lot of absenteeism in having to shut down schools. And I just want to credit everyone's teamwork and staying together throughout this pandemic to this point. By looking at our data, along with some of the changes with the mask mandates, I think we're in a good place to follow suit on the 28th. So that's my synopsis. Sorry to be long-winded, but I wanted to give the committee some of those data points that it's very encouraging, especially with the vaccination rates in the schools.
Thank you, Superintendent Gallagher. That was really helpful. I will say from the city side too, we are going to still continue to actively look to set up vaccination clinics and booster clinics going forward. I mean, we hope those numbers continue to rise. I do think the messaging is really important. Like, we're not saying, throw your mask away. We're saying, it's mask optional. So there's going to be times that, you'd probably feel more comfortable in a mask, and there are going to be some times that you don't. But we're going to, again, I think shifting the focus back to students and families and giving them that choice, I think we're in the right spot to do that now. Does anyone else have any questions for Superintendent Gallagher, or just want to add to the discussion? Mr. Cole?
Yeah, thank you. I'm just curious because I did attend the Board of Health meeting last night, and I know there was some mention of what to do with children that are 5 and under, because obviously they're not, the vaccine hasn't been deemed as safe yet for that age group, and that would affect preschool and pre-K students. So would that simply translate to parents of those children who are unvaccinated under age 5 be masked, or would the strongly encouraged descriptor go with that too?
I can just comment for what the Board of Health talked about last night, and I'll let Sean chime in with that. But they did bring that up last night. Again, hopefully we get to that point where children under 5 can get vaccinated. But in the meantime, they really just talked about, again, it shouldn't be a deterrent to going to mask optional for those families. I think it's just more, our messaging should be the people like surrounding that child should be vaccinated. That's kind of the messaging that they spoke of, and I'll let Superintendent Gallagher chime in with that as well.
Yes, and that's I think that's also part of why we continue to meet with our medical advisory team, because we'll get updates regarding when those vaccinations will be available for that population. But as Mayor Reardon said, when you're looking at the statistics, many of the family members for those younger students are already vaccinated. As you all know, I think we're at 98% or so with our faculty fully vaccinated. So when we're looking at the schools, especially for the younger children, we're still going to encourage masking, but we're not going, I think, to mandate that at this time for the younger kids. And then we'll continue to provide updates for those families. And as Lauren McDonald has done throughout this, following suit with Kathy Riccio, once those vaccinations are approved, we've been scheduling through the mayor's office vaccination clinics, right out of here, out of the NOC. So I think it's something that we continue to monitor, continue to look at, but at this time, we would still leave it up to the families to be mask encouraged and make those decisions.
School Committee Member Walker?
Thank you, Mayor. Superintendent Gallagher, I just have a quick question. I am prepared to make a motion as soon as everyone's questions get answered. Just a question for information purposes. Have you had a chance to gauge comfort level of staff, or do you have a sense of that, particularly classroom teachers?
Yeah, so I think for our medical advisory team, each week we meet with principals. And when there's individual questions, obviously Lauren McDonald answers those for our teachers. But because we're meeting on a weekly basis and we're keeping communication open, any concerns or thoughts that come out of those meetings, we follow up with either Mike Allard, Dr. Sue, or Lauren McDonald. So we feel pretty confident that where our faculty stands right now with, as we move with our changes in policy, if that's what we decide to do. So, and this is why I also think it's really important. I think this is the first piece, and then we continue to work on our protocols and mitigation strategies moving forward. But on a weekly basis, we meet with all of the principals, and they give us input because there could be different concerns or protocols in place for the Brez, to the high school, to the Mullen. So I think that's been one good thing is we've kept communication open, through the faculty, to the principals, to the medical advisory team.
Mr. Menon.
Thank you. I at the outset, I will support removing the mask mandate, but I do have 2 points that I just wanted to share. One is that I've stopped looking for logic in the way the state recommends and responds to the pandemic, but I do think it's a mistake to lift the mandate immediately after kids and staff have been out of school for a week. Hanging on just one more week would mitigate the likelihood of a surge. Having said that, I do support lifting the mandate, but also as a writer and somebody who finds words to be important and very powerful, I really cringe a little bit every time somebody says mask optional, and I would really prefer our policy language talk about encouraging the mask wearing and lifting the mandate as opposed to going mask optional. And my rationale for that is that these days there's been a lot of tension about a lot of issues, and I would hate to see kids split or teasing one another about optional mask wearing. So I think our position should be to encourage mask wearing and to lift the mandate. That having been said, I would support a motion.
I'll just comment on that too. The Board of Health, the way they were phrasing it last night too, and I think I kind of like the way they did it. They were calling it more, we're changing to a mask advisory opposed to a mask mandate. So, the advice is, especially in public places, that you should have a mask that works for those. But again, it's not mandated. Ms. Spalding, I think we just have 2 more people with questions, and then I'll entertain a motion.
Thank you. I was just curious if we have an idea of how many pre-K and kindergarten teachers are vaccinated.
I think we don't want to get into a lot of specifics, but as I would say, it's 98% overall of our entire faculty and support staff. So that's over 400. And it's not just teachers, it's IAs, cafeteria workers. So we're I think for the adults that are coming in every day, we're in a great place. And just one last point, because I know we want to get to the vote, but also just for the families, for the younger children, Dr. Lundergan, who is a medical advisory pediatrician, during those medical advisories, those questions are asked towards him, and he feels strongly to allow the families to go, mask encouraged also. So we also, it's not just, medical advisory and just looking at the data, but we also do have our local pediatrician that weighs in on masking. And I just really believe the rates are so low that he's comfortable also with lifting the, of going to mask encouraged.
Yeah, no, we're definitely in a good spot right now. Anna Jakes right now has single digits as far as staff out and COVID cases. So Ms. Hall with the last question.
Hi, thank you. My cat loves Zoom, so there's nothing I can do about that. So I'd like to start by reading a statement from Member Callahan, if I may.
As long as you read it just like he would say it, then yes.
Yep, I have it in writing here. So Brian has expressed to me his regret at not being able to make it today and has asked me to make this statement on his behalf. To avoid any open meeting law issues, his statement has not been shared with any other members of the committee until right now. When debating masking and vaccination protocols during the pandemic, I've always stood by the data, and the data now indicates that mask optional is the way to go. Our district's vaccination rates are incredibly high, and our local transmission rates are incredibly low. On Wednesday, our medical advisory committee agreed that the district should go mask optional, and as we've been looking to them throughout the pandemic for guidance on masking, we should follow it for unmasking. Thank you, Brian. So that's his statement. I'd also like to say a few words. I am supportive of lifting the mask mandate, but I want to make it clear that I don't take this decision lightly. There's been a lot of polarized thinking around this pandemic. Last school year, it was remote versus in person. This year, we have a lot of masking or not masking. But the fact is, it's far more nuanced than that. So I just want to be clear. My vote doesn't mean I think the pandemic is over. It doesn't mean I think that it's no longer the district's responsibility to support local public health efforts. It's quite the opposite, in fact. The great thing is that we're entering this new phase where we have access to effective mitigation tools. This past fall, we did not have vaccines for our ages 5 to 11. We did not have rapid at-home tests. We didn't have access to high-quality masks. We have all these things now. And that's what I would say to people who are concerned about lifting the masks, the mandate, as we're returning from a vacation, is that we can use these tools. And I assume the district will encourage using these tools. If you think you have been exposed, you can take a test. Maybe you wear a mask for a few days. It's so wonderful to have these options. When last year, if you had a close contact, you get the contact trace call. That happened in our family. You're out for 10 days. I'm so happy that we've moved beyond that, and we can handle these things ourselves now. We can handle exposures ourselves now with the tools that we have. And then the last piece I'd like to make, which is same as Mr. Menon was saying, is we really need to create a culture of mask choice. That this is a personal choice. There shouldn't be any judgment or criticism of someone wearing a mask or not wearing a mask. So that's it for me. Thank you.
Thank you, Ms. Hall. Ms. Walker, do you have another question or no?
I'm prepared to make a motion if the
Okay.
is ready.
I'm okay with that, as if everyone else is.
Okay, so I would propose that we vote to rescind the existing face coverings policy. And if I can get a second, I can explain that.
Second?
Second.
All right, I'll go into discussion. So we did meet as a policy committee earlier this week. I would say that the primary reason that I'm making this motion today is because of the diligent effort on the part of the administrative team, as well as the mask advisory group, and the recent decision of the Board of Health, in conjunction with the decision at the state level. But I do think really this should be a local decision driven by facts and data. And we have developed metrics. And I think we should stick to those metrics. And I think rescinding the face covering requirement at this point is consistent with the metrics we had established previously. The reason I'm proposing to rescind at this point and not necessarily revise our existing policy is that I think if we as a school committee and the superintendent believe that we need a policy in place, we will need some more time to work on that. And this committee does not have a current draft in front of them. Frankly, the policy committee did not have time to put together a draft because we were still waiting to get input from others over the course of the week. I think rescinding the policy at this point will give the ability of the administration to continue to operate the schools in a safe way, strongly encouraging masks to be worn in certain situations, as the superintendent outlined. There will be some circumstances where masks will still be required, particularly on the bus transportation, because that's a federal requirement. And I believe they will be required in the health office. Those are operational things that I think the administration is capable of handling, and each school building principal will also be able to implement those at their discretion. If, like I said, we as a school committee need to take action on a policy, I would prefer to do that at a future time. But I think there's reason for us to act more immediately because of the state action, and to give some direction and guidance to families as they are returning from school vacation. So that's an explanation of why I'm making that motion.
Thanks, Ms. Walker. Does anyone else have any discussion? Mrs. Kennedy, did you get the motion, or do you want Juliet to repeat it?
No, her motion was to rescind the face covering policy.
Correct.
Is that all you want me to say? Okay.
All right, let's take a vote. All those in favor, we'll do a roll call vote. Mrs. Kennedy?
All right. Mayor Reardon,
Yes.
Ms. Hall,
Yes.
Ms. Walker,
Yes.
Mr. Callahan is absent. Ms. Spalding,
Yes.
Mr. Menon,
Oh, you're on mute.
Muted.
Yes.
Mr. Cole.
Yes.
Okay.
All right, the motion passes. So thank you, everyone. Again, I think Ms. Walker is right. I think at a later date, if the policy committee comes forth with an updated policy, we'll take that on then. But as of now, the current mask policy is rescinded. The superintendent will, right after this, get that information out to students before they leave school today, and we'll work through all of our communication channels to get that messaging out to the public. So again, thank you for everyone for their work on this and putting this special meeting together. And I will entertain a motion to adjourn.
So moved.
Second.
Who
Mrs. Kennedy,
seconded
roll
that?
call vote. I think Ms. Hall seconded.
Okay, sorry. Roll call vote to adjourn.
Yes.
Mayor Reardon,
Yes.
Ms. Hall,
Yes.
Ms. Walker,
Yes.
Ms. Spalding,
Yes.
Mr. Menon,
Think about this. Yes.
Mr. Cole.
Yes.
Thank you.
All right, meeting's adjourned. Thank you, everybody. Have a great weekend. If you're going
Thank
away, have a
you.
good vacation. Thank you, Superintendent Gallagher, Ms. Furlong. Take care, everybody.
Thank you,
Bye.
everyone.
Thank you, Sean.
Thank you, Sean.